Welcome to CareTree.me. CareTree is a collaboration platform designed to replace the paper records in the home health and senior care industries with an online platform that centralizes information and automates communication with care stakeholders.
The process that we were going through was basically the utilization of emails, where I would send out an email and then they would respond individually with questions. I would find the answers to their questions, and then I responded to a reply all so that they would all see the question as well as the information that was being shared. But it was this back and forth of me being the keeper of data from various sources that I then had to resend to them. You know, the family calls me, I call the caregiver tells me something, I call the family back.
Right now what we're doing is our caregivers are required to contact us on the phone, and then they are told to follow up, and it can be a variety of ways. Either they come to the office and fill out an actual incident report, which can be inconvenient, or they're putting something in email format, so then we access it that way. Really, we're not getting the documented information in the time that we want it.
CareTree allows users to create profiles based on their relationship with an individual. They can then invite other care stakeholders via email or through Facebook. In their CareTree profile, a user can select which information they want to receive about someone they are caring for and when they want to receive it, daily, weekly, or immediately. This ensures the right information is getting to them when they need it. In an individual's profile, it will show what comments are being made and by whom. This is the key dashboard for caretakers to see what is happening with an individual. This information will be searchable and categorized so management can easily find records for their quarterly government reports, or doctors can just see the medical actions happening. Users can create groups to easily share information to a specific audience. This could be the caregivers for a single individual, their family members, or their doctors. An administrator may also create a group with all of their caregivers so they can easily communicate with all of their employees at once. All the group communication is also accessible from a forum. This makes it easy to track what is going on in a conversation about an individual and the history of that conversation.
This whole ability to communicate information as well as to give family members access to the record so that they can find some of the information themselves without having to ask questions and then me refeed them information would be so invaluable.
When we're in the loop, we can then manage that situation in the way that it needs to be managed, whether it's an urgent situation or whether it's something that we could contact the family when they're available and able to access that information. So having information about their condition and real time when they're in their own homes is absolutely critical.
This opportunity is an $800 million market counting just existing home health and senior housing residents. It will be growing as the baby boomer market ages and begins needing care. There is actually an expected shortage of 2 million elderly care workers, and one of the only ways to fix this shortage is through more efficient care using technology such as CareTree. We are very excited to announce that we have been selected as a finalist for the inaugural AARP Health Innovation Live Pitch Contest at this year's National Convention. It will give us an opportunity to discuss CareTree with the VC market, but more importantly, we can get tremendous feedback from thousands of potential users. Thank you, and we look forward to seeing you as a user of CareTree.